Welcome, everyone. All right, I'm going to go ahead and get us kicked off because we have a packed agenda today. My name is Olivia Itigo, and I have the privilege of serving on SAMHSA's 988 Crisis Systems Response Training and Technical Assistance Center that's operated by Alterum. As you can see today, we have closed captioning enabled for today's meeting. We also have an ASL interpreter capabilities. They will be spotlit throughout the session. If you need any additional tech support during the meeting, please feel free to message me, Olivia Itigo, using the chat function, and we'll try to get that addressed for you. You'll also notice that we have enabled video and chat functions here, and would love for anyone who is joining us today to put your name and organization in the chat so we can start to say hello and see who is on the line. As a reminder, we ask that all participants remain respectful of others and refrain from utilizing harmful or demeaning language. And just a quick disclaimer here about the views expressed in this material, not necessarily reflective of the Department of Health and Human Services. And then a quick overview of Alterum there that you're welcome to see. And then I will pop right into our agenda. Like I said, we have lots of great content coming up. We're going to jump right into some introductions of our leadership team. And then we will move into a great presentation from Chris Soderquist, who will talk a bit about systems change and will be an example of some of the great speakers and content you can learn about or participate in with the 2025 Policy Academy. Then we'll then talk more about the Policy Academy and what that application process looks like, and then get to hear from participants from last year's Policy Academy to hear about their experience and how that went. So that's really going to be the focus for today. Then we'll also discuss some upcoming TTAC events to come. So with that introduction, I will pass things over. We'll go back to those slides that I just clicked through quickly at the end here. And I will pass things over actually to Dr. John Palmieri, who's the Deputy Director of 988 Behavioral Health Crisis Coordinating Office.
Thank you. Hello, everyone. Good to see you all. So again, I'm John Palmieri. I think many of you probably know that from the 988 office. Some of our leadership team is actually at CrisisCon. I think Olivia mentioned that CrisisCon is happening, so some of you may be there as well. But I appreciate you joining us for this hour to hear a little bit about our upcoming activities with a particular focus on kind of cohort 2 of the Policy Academy, which we'll talk about in a little bit more detail over the remainder of the session. But Monica, Jill, others are at CrisisCon, and I hope for those of you who are there that you're having a good experience and connecting and learning and innovating and facilitating growth and progress, because that's kind of at the end of the day what it's all about. So appreciate that. Next slide, please. So again, we're going to talk a little bit more about the Policy Academy today. And I know we've talked about this before, but one of the reasons that we see the Policy Academy as being essential is that we recognize that there are tremendous challenges and also tremendous opportunities in the crisis space. And with the implementation of 988, there has been incredible acceleration, incredible growth, lots of enthusiasm and motivation for transformation, more funding. All of those things are fantastic. And at the same time, they have created some challenges in terms of role clarity, in terms of organization, in terms of priorities and prioritization of which services and how and when and who's being served. And so the Policy Academy really is intended to be reflective of the fact that states, territories, and tribes are in very different places with respect to crisis system development. That is completely expected. And we want to be able to support participant teams in this Policy Academy wherever they are along the way and wherever their goals are or whatever they've identified as their priorities. So this slide kind of lists different archetypes of development, I guess, for lack of a better word, in terms of where state, local partners, territories, tribes might be in terms of their growth and their establishment of a crisis continuum, recognizing that these are kind of rigid archetypes. It's likely that many of you will find elements across all three of these that may resonate in terms of where you are. So they're not intended to be sort of mutually exclusive or static, but they are intended to describe sort of, again, that recognition that there are systems that have been at this for a really long time, that have been working to develop a full array of services, that have thought a lot about the role clarity and the oversight and the authority, and how decisions are made and how the performance of the system is monitored. And then there are systems that are developing in different ways across all of those particular elements. And so they might have some services in place, but some of the clarity may not exist. Some of the collaborations or the partnerships may not fully be vetted out. Some partners may be at the visioning stage where they're really thinking and deliberating carefully about what their vision is for their communities in terms of serving them with respect to crisis services. And so this slide is really intended to just normalize to a large degree the fact that people and partners are at different places, and this is all kind of fertile terrain for a policy academy and for engagement and conversations about crisis systems transformation. I think I was briefly muted, but hopefully you can hear me. So with respect to some of the state functions and state, territory, tribal functions with respect to how they're developing their systems, there's a lot of responsibility and a lot of accountability at the local level, and a lot of challenges and a lot of opportunity. So clearly we have driven 988 to be optimized at the local level. We very much feel that answering 988 contacts at the local level is ultimately going to serve people better. We also recognize that it's very much within the lanes of local behavioral health authorities to link those 988 services to the broader crisis continuum and to the broader behavioral health system, so that there's prevention, there's aftercare, there's linkages. We're not just wanting to create a system where the only opportunity for people is to cycle repeatedly through crisis. We want to obviously have people get what they need so that they don't enter in crisis in the first place. We also know at the local level, there's lots of opportunities and lots of movement and progress with respect to funding, with respect to legislative activity, with respect to appropriations for serving and expanding the crisis continuum. And also a lot of opportunities for coordination at the local level, understanding that with 988 centers, a lot of the mobile crisis teams, a lot of the stabilization services, a lot of 911 services, all of that is very local. And so it's important that those services be coordinated and integrated at the local level to, again, be able to serve people in an optimal way. And then there's a lot of responsibility and accountability at the local level for sort of the oversight, for the performance of the system, for the outcomes, for the overall health of the network. SAMHSA has issued and will continue to issue guidance and provide technical assistance around sort of a shared vision and alignment around those services and what we see as a vision for crisis services. And it's going to be essential for states, territories, tribes to take that vision and apply it to their own local circumstances, to tailor it in a way to their populations, to make sure that their communities are best served in a way that makes sense within state law, within state regulation, and with the priorities that have been set at the local level. Next slide, please. These next couple of slides really are just intended to speak to the incredible movement and momentum that I've spoken to about the state, local progress with respect to funding, with respect to appropriations, and legislation that has driven a lot of movement in the crisis space. And so many of you, I believe, are likely tracking what NAMI maps out with respect to progress at the state and local policy level regarding appropriations, funding, and legislation. So this is intended to demonstrate just how much movement there has been in a fairly short amount of time to expand crisis services and expand capacity around 988. Next slide, please. Again, this is sort of similar in that vein. We know that there are a number of states that have passed 988 fee legislation, as is permitted through the National Suicide, that is permitted through the Hotline Designation Act. But there have been many states that have passed appropriations and other pieces of legislation outside of a 988 fee that have continued to expand and support 988 services and crisis services more broadly. Next slide, please. I did mention some challenges with the growth and with the acceleration. And so these are things that we're just continuing to work through. These may be things in the next Policy Academy. I'm guessing there'll likely be things in the next Policy Academy that we'll talk about. They certainly were some of the things that we talked about in the first Policy Academy. But trying to align on data, trying to coordinate those lanes of communication and the authority, the complexity of those relationships, trying to make sure that the system reflects the local political realities and is aligned with the local political realities and the regulatory environment that exists there, among other challenges that our partners have talked about. Next slide, please. And so one of the ways that we are leaning into this space, so we've talked a little bit about the Policy Academy, and that's what we're going to focus on today, obviously. But our Training and Technical Assistance Center has more broadly been leaning into this opportunity to work with states, territories, and tribes around partnership to support expansion, to address some of these developmental challenges, to provide ongoing technical assistance, to lift up when there are practices or when there is learning that can be shared among peers and among partners around things that have worked in localities that have struggled with the same challenges. We obviously also have a lot of great national associations like NASHBID, NAZADAD, others, the National Council, many associations and national organizations that have provided tremendous and continue to provide tremendous support and learning and technical assistance around all of this work. Next slide, please. So I'm going to happily hand it off to Chris Soderquist, who will talk a little bit about kind of whetting your appetite for what will come up in the Policy Academy related to systems design and systems thinking and systems transformation. I'm not going to read everything here, but I will just say by way of personal experience and recommendation is that Chris is really an amazing thinker and has a unique ability to transfer knowledge in a way that is usable, that is practical, that is digestible, and just reflects incredible aptitude for trying to fit together many different pieces and contingencies and relationships, which is something that we all deal with because our systems, as I said, are incredibly complex. And so Chris was at the first Policy Academy. He's done some work actually within SAMHSA with our own 988 office, which I think speaks to the confidence that we have in the work that he's done around systems thinking and systems design. So I'm really excited for him to be here to give you a little bit of an overview of some systems transformation thinking, as kind of a signal for what's to come in the Policy Academy that will be in March. So I'm going to hand it off to Chris.
Oh, thank you, John. It's always a pleasure to see you and work with you. Good afternoon, everyone. What I'd like to cover this afternoon is just a brief introduction to how to think about systems design, systems transformation, and how it can relate to the work you're doing, the very important work you're doing, and the complex challenges you face. So this is a framework to think about, and then we can dive more deeply into it at a future date. But you know, my expertise, we can just move beyond that. So just to kind of think about what you're up against. You're up against, in a variety of situations, things seemingly getting more and more challenging, more and more complex. The youth in particular, like the anxiety, depression rates, well documented. They've been on the increase for many years now and do not look to be abating. Same with anxiety, suicide rates, etc. So these are actually age ranges that are moving into the systems that you're all trying to work on and manage. So if you want to think about what you're looking at in the long term, and a big picture goal is, I think, is to take the percentage of people, youth, adults, et cetera, that are in crisis, which appears to be increasing, and find some ways to bend that curve to your liking, which is to create a future where percentage of folks in crisis goes down. There's fewer in crisis, fewer dying by suicide, and more getting the support they need to stay out of crisis. So if that's what you're looking at, the challenge, of course, is that you're facing a system of systems. There are groups, entities at the local level, at the state level, at the national level that need to start working together. There's departments within HHS and other departments that need to work together. There's geo-routing organizations that need to be pulled into the system. There's Vibrant. There's just a variety of organizations, and this is an ecosystem that you're managing, you're working with. An ecosystem is really a group, an organization of organisms that are all working together and need to communicate together and work effectively together to achieve the results you're looking for. And coordinating groups across an ecosystem requires a special type of leadership. So I don't know how many of you can relate to to this type of a situation, whereas I'm sure glad the whole is on our end. And the issue, of course, is you may be doing well in your part of the system, but on other parts of the system might not be doing well. And how you all work together to make sure that all the system is performing effectively is actually very, very important. So let's just kind of recognize that the problems and challenges that you face are different than often the kinds of problems and challenges that you face in your daily lives and that we come used to. We're used to routine problems, problems that actually have a routine for solving them. Not that they're routinely happening, but they are a routine that you solve them. These are problems that are easily defined, an obvious proven solution, and there's an expert that you can call to solve the problem for you. And this can be on the simplistic order of your office runs out of toilet paper. There's an administrative assistant, a process of ordering it, whatever. And you go to the expert and they take care of the situation. It can be on the more, unusual end of the spectrum here. That's a routine problem, like, a pandemic, a new virus comes out, a novel virus comes out. There is a scientific method for developing the vaccine. Doesn't happen often that they have to come out with a brand new vaccine for something that virulent, but when they do, they have a process for doing it. So when there's a routine to solve the problem and experts that you can kind of basically hand the problem to, those are routine. Unfortunately, we're facing an increasing number of adaptive challenges, and the challenges you're facing are more adaptive. It's hard to define what's the problem. Is it our problem, their problem? Where's the problem? How do we just find the problem? There's no clear solution. A bunch of people have a bunch of different ideas of how to solve the problem, perhaps. And there's no one expert who's got the solution. So when you're facing an adaptive challenge on that end, then there's only one thing that you can do because it's a fundamentally different problem. So a routine problem, it's like give the problem to the expert and start working on it. If it's a adaptive challenge, the bias has got to be towards learning. And so Ron Heifetz says that someone exercising leadership is orchestrating the process of getting factions with competing definitions of the problem to start learning together, start learning from one another. And that's your challenge, is to start learning together. And so you could be like this ecosystem here of the education system where no matter what age level you're looking at, they're blaming the previous or the younger group, the cohorts, the teachers. So that's an ecosystem where everyone's blaming everyone else and not working well together. So what your challenge is, and a lot of challenges that I'm working on with public, with children and youth behavioral health in Washington's one of my clients right now, is to trying to get organizations and groups, factions within the system to start working together and learning together. And if you can think about this kind of a hexagonal system here where we need to pull these organizations together, make them more cohesive, and then start learning together, that's the challenge. So the question really is not only do you have to do that, but ultimately the big question is how do you do that? And this is a messy, difficult problem. A system of systems problem is called a mess. Technical term, you can look it up. So you're dealing with a mess. And so how do you make sense of the mess? So systems change requires the ability to simultaneously work on 3 levels of the system. And on one level is a system of systems. These are the policies and the processes. These are the resources. These are the rules, the systems that you set up. And these are what we typically focus on, right? So what are the policies, legislations? Where do we invest here? Like that kind of stuff. That's the system of system. And it turns out to be infrastructural in nature usually. What's the national, state, local, regional, private sector, infrastructure, including things like geo-routing, non-traditional partners. How do they like make decisions and allocate and change and work on their resources together? And that's what we focus on. Unfortunately, that's not the only part of the system. There are relationships and power dynamics that actually determine how those systems are set up and how they're managed. And this is the human structure. This is, do people get along, not get along? This is one organization that has power and authority over one area. Another one has different power and authority. They often are butting heads. So how do you get that relationships and power dynamics out on the table, surface, and start working on it? And the challenge is that you have to be able to see different perspectives in the system. So if you look at this, you're going to see a deer, an elephant, and a giraffe. On the other hand, if you look at this, you're going to see a seal, a goose, and a penguin. But of course, depending upon where you are in the system, they're the same darn things. It's really just your perspective of how you're looking at it. And the challenge of managing a system of systems is that multiple perspective thing where you have to get folks who are seeing it different ways to actually come together and actually see the whole and to work on it together. So ultimately, it comes down to our mental models, and that's where the focus and the emphasis of the work has to be. This is the way we think the world works or should work. This is our mental maps. This is the data and the resources and the research and the ideas in our head, our beliefs, our perceptions that tell us, okay, this is what's going on, this is why it's going on, and this is how we should work together to solve it. And if our mental models don't change, then the way we work together don't change, and the systems and the policies and the investments that we make also don't change, and we get the same old stuff. So ultimately, what we need to do is to orchestrate a process where we can transform the overall mental models that are driving how we all work together. And there are a set of tools that can help you to do that, but you need to be able to see all three simultaneously. So just to conclude here, when you're dealing with systems transformation, it's an adaptive challenge. It's an adaptive leadership issue. You have to orchestrate learning across the system. You have to get groups and organizations from within the system who are kind of sub-optimizing, working on their own piece to actually see how they need to work together more effectively to optimize the overall system. If you can do that, then you can actually generate the future you're looking for. And so it's really getting all of these areas and working on them simultaneously that's going to help you to achieve that. And unfortunately, you can't just sit back in a corner and just think it into being. It actually requires trying to change it. So Kurt Lewin is famous for saying that if you want to understand something, try to change it. So it's one of those things where there's some implementation, trying some things, getting some conversations going, see what you learn as you're trying to change the system, and then feed that back into improving your understanding and take the next action that actually is better than before. So really trying to change something, don't just sit back and wait. Very important. So you're creating a cycle of learning across all these dimensions. And there are tools that can help you to do that. We covered these at the Academy last year. There's ways of mapping out the systems, the resources, and the decision rules. There are tools for mapping out the stakeholders and the relationships and how they're working together and not working together. And there's some adaptive learning skills that are required to really surface and transform mental models. And we went into that as well. So those are a variety of frameworks and tools that you can use to accomplish the objective of orchestrating learning across the system, which is ultimately what you have to do. And so that's what I've got for now. And if you all have questions later, let me know. I have to rush off to a dentist appointment, which I couldn't move. But I appreciate your time and attention this afternoon.
Thank you so much, Chris, for providing us with a sneak peek of the fantastic content we'll be delving into at the Policy Academy 2025.
Thank you. Take care.
Bye. Good afternoon. My name is Adelicia Carrillo, and I have the privilege of serving as the project co-director for the SAMHSA CSR-TTAC. We're thrilled to announce today the 2025 Policy Academy. Our focus today is to offer information regarding the overall Policy Academy program, the application process, in-person convening, and answer any questions you may have. The 2025 Policy Academy will be a second cohort from our 2024 Crisis Systems Design Policy Academy. This program will focus on supporting teams with coalition building, clarifying roles, and applying systems engineering and design principles to help develop and improve policies and practices for crisis response systems in your state, territory, or tribe. Next slide. The Policy Academy program has three main components. First is the preparation phase. Once the 10 participating teams are selected, the CSR-TTAC will host an orientation webinar on January 7th to kickstart the Policy Academy program. Following that, we'll conduct 3 virtual technical assistance planning meetings to help prepare teams for the in-person convening. The core event of this program is a 2-day in-person convening in New Orleans, Louisiana on March 19th and 20th of 2025. Teams will designate a travel team of 8 members who will attend this convening. During the event, facilitators and subject matter experts will guide team discussions, covering topics such as systems design, just as we saw today with Chris, funding infrastructure, youth in crisis, and embedding equity, among others. Then we have the follow-up phase, where over the next 6 months following the Policy Academy convening, teams will receive a follow-up virtual technical assistance and host a site visit to continue supporting the team's implementations for the improvement plan. Next slide. So let's talk a little bit about the program components and also the team commitments in this program. So the teams will be expected to attend the virtual orientation session on January 7th to participate in the preparation activities, which includes formalizing the work group and attending 3 virtual meetings, to designate a travel of 8 members to attend the 2-day in-person convening in New Orleans, and to engage in post-convening technical assistance activities. Next slide. So one of the most important aspects of the Policy Academy is the work team composition. We recommend assembling a team of 8 to 20 individuals representing a broad range of perspectives from your community. We are looking for teams that are diverse and inclusive, drawing from various agencies and sectors that play a critical role in crisis systems. Next slide. And in here, we have a long list of potential prospective voices. So here's some key roles that you should include in the Policy Academy team. The Mental Health Authority from your state, tribe, or territory, Substance Abuse Agency, if applicable, Medicaid Authority, individuals with lived experience, and parents who have supported youth in crisis, representatives from 90-day center leadership and mobile crisis providers, experts in youth behavioral health, and leaders from community-based organizations. Additionally, your team should include representatives from fields such as state public health agencies, the Association of County Behavioral Health Authorities, public safety answering points, healthcare systems, public safety, law enforcement, workforce development agency, state education departments, decision makers in your community, suicide prevention coordinators, diversity-focused representatives, and mental health block grant coordinators. Now, I will turn it to my colleague, Erica Pedersen, to discuss logistical information for the event and the program.
Hello, everyone. My name is Erica Pedersen, and I'm the meetings manager, and I'm going to tell you a little bit about all of the exciting logistics of New Orleans. So we'll be a full 2-day convening, March 19th and 20th in the Big Easy. So we're excited to explore that destination a little bit, but also to really get into some great content. Next slide, please. So part of the in-person convening in March, lots of things that we'll be covering, mentioned earlier, systems design, funding infrastructure, embedding equity in the crisis system response, youth in crisis, effective implementation of 988, and workforce development, training, recruitment, and expansion are all things that could be discussed and covered in those 2 days. And one of the big things is a team discussion to strategize and plan, facilitated by a consultant or a subject matter expert. Next slide, please. So how do you go about applying for this program? There is an online form, and we will share the link in the chat if you would like to take a look at it yourself or share it with somebody in your organization. But the main components that we'll be asking you to fill out and provide for us as we go into the evaluation of the applications is looking to have a primary contact or organizer, somebody who's kind of going to bring all of the information together, and somebody that we can coordinate logistics and the travel group especially, but also the meetings and pre-convening meeting discussions. So you'll also have to know your goals for participation in the event, and you'll be asked for your state or organization or tribe's readiness and capacity for systems improvement and technical assistance needs, and then to do a self-evaluation of current systems that you have in place. And you'll also need to build a team roster of 8 to 20 people. 8 being the minimum because that's what we're asking in person for the meeting. But we also would like you to have a larger group at home to help build your systems. Next slide, please. So here is the timeline for the event that, so currently we are open for applications. The official opening was yesterday. So 6 weeks from now is the close, which is November 27th, the day before Thanksgiving. So that gives you a good amount of time to work within your organizations and find your people and build your team. We will release and let people know who are accepted by December 20th. So all successful applicants will be notified by that date. And then January 31st is when we would like to have everybody finalized on your team. Primarily, we're going to take the month of January to get everybody scheduled for hotels and travel and all of those fun logistics things. So we'd like to have that wrapped up by the end of January. And then off you go to the convening on March 19th through the 20th. So expect to travel probably on March 18th with a return home on March 21st. Next slide. And finally, if you'd like to click on the QR code here, you can find your way to the application online. Otherwise, we will provide it in the chat as well. So that ends all of the logistics information for the travel and the in-person convening. And next, I would like to introduce some previous participants in last year's convening. So we have Zachary Black Owl is the Community Outreach Specialist for the Cheyenne and Arapaho Tribes 988 Tribal Response Program in Oklahoma. And Don Ramos is the Executive Director of the Prevention and Recovery Center at Comanche Nation. Don and Zach are both members of the Oklahoma 988 Tribal Work Group and part of Cohort 1 from the Policy Academy 2024.
Thank you. Hello, name's Don Ramos. Like she said, I am the Executive Director with the Comanche Nation's Prevention and Recovery Center in Lawton, Oklahoma. And I was grateful to be part of the 988 participants of the Policy Academy of Cohort 1 that was held in Arizona, along with Zach and 6 other members of our group here, which was a great opportunity for us to get together and participate in. It was a great learning experience. And we're at an advantage because we have several 988 grantees, tribal grantees here in Oklahoma, along with the other participants that we work with ODMH, the call center, and a member of one of our urgent recovery centers in town in Oklahoma was able to be one of our participants in our policy academy. It gave us a great opportunity to learn a great deal. And I'll turn it over to Zach. Share some of his thoughts and stuff on that.
Yeah, good afternoon, everyone. Thank you, Don, for that. Don's like my uncle in crime here. We be going back and forth with all these different policy academies with SAMHSA. So, just being able to be here in this space as Indigenous people, we are really grateful and thankful to SAMHSA for allowing us to share our experiences with you guys and how it's been beneficial for us. And for myself, giving me a quick introduction, I have the honor of working for my tribe, the Cheyenne-Arapaho Tribes of Oklahoma, as the community outreach specialist for the 988 Tribal Response Program. And my experience and how we benefited from the 988 Policy Academy, to me, it's just been a big, crucial step in how tribal nations are addressing crisis response and mental health needs within our communities. And to give you a better picture, before I even began working with the 988 response program, I was in a place where I needed help, and I lost my mother to cancer in 2022, and I became overwhelmed with grief and so on. And time fast forward, and one of those dark moments of grief, I reached out to 988 myself. And in that moment, I was connected with someone who listened without judgment, and that call was a lifeline for me. It was a turning point that led me to open up and ask for help, and eventually led me to start my journey toward healing. And that experience has motivated me to become an advocate for 988, not just for myself, but for my community. So, using my lived experience, I advocate for 988 and being a part of this team. And I think that's what's so unique about our team with this group was we had over in our work group we have over 12 to 15 tribal nations come together, and we come together for a common goal, and that's what I feel like this policy academy created for us. It allowed us all to come together as tribal sovereign nations and to come together as one goal and unite under one group to figure out how we're all going to address the same things that affect our communities. And that was the big thing about it. And attending the 988 Policy Academy, we all got to go to Tucson, Arizona I think it was February, I believe. And it was a very beautiful place. It was not desert weather though. It was very cold and it was rainy. I do remember that. But one of the most important lessons I've taken away from there was the value of integrating cultural values and traditions into the crisis response system and explaining what that is and how important it is to us as Indigenous people to have, crisis call centers, behavioral health therapists, doctors, and whoever it is who are providing these services to our people. This for them to have the knowledge and for them to be able to listen and for them to give us the time to explain why these things are so important to us as Indigenous people. That was the big takeaway I take from there, because there are a lot of, especially if you live in Oklahoma, like where I'm from, there are a lot of different people who don't take the time to even do things like that. A lot of our providers, a lot of different other people don't take the time to even listen about where the land they're from or what other tribal nations are in your community or just little things like that, and when it comes to crisis response and you're trying to get someone to trust you when you're battling stigma and battling all these other things, these things are important. This is where it really helped us. And this is something that we brought back with us to our tribal nations and how we're able to move forward and progress on our different objectives. And the 988 initiative has been more than just access to a number. It's about, training community members as mental health first responders. It's about creating stronger networks of care and ensuring that our traditional healing practices can coexist with modern mental health services. So To me, it's about making crisis response not just accessible, but also culturally relevant. And I'm looking forward, moving forward, this work. I'm committed to 988. It continues to evolve and to better serve tribal nations. Our personal experience with the service has shown me that it is a vital resource, and we need to keep refining it so that no one feels left out or misunderstood when they are in crisis. And through the knowledge and connections gained through the Policy Academy, I believe we can create more responsive and culturally attuned systems that truly meets the needs of our communities. And my hope is that every tribal nation will not only have access to immediate crisis through 988, but will also be empowered to create systems that promote long-term wellness for all of our people. So closing, I want to thank you all for giving us the time today that you're involved in this crucial work. Thank you. And together, I think we're going to be able to build something truly meaningful, and I'm proud to be part of this journey. Thank you all.